Joining us now via Skype from Lagos is Dr. Nsiabase Kanem, public health physician and CEO, Trinity Healthcare and Foundation. Dr. Abbas Kanem, it's good to have you join us right now.
Good morning.
Great. Now, the Presidential Task Force on COVID-19 has expressed its frustration on the lack of compliance to all the health protocols that are given out there. And now they have asked state governors to take, or state governments to take charge of the next phase and ensure that people comply. But we've not seen that kind of effort from any government level as from the eyes of the people. But the numbers are going down. Would you say that water is just finding its level by itself as it is?
Well, I wouldn't say that. I think as it is, Nigeria is still experiencing the scourge of COVID-19. Yes, the numbers are dropping. One would not fully explain what is responsible for that. We may not really say that we've peaked, neither would we say that we have plateaued. But one of the things that could be responsible for this is the fact that most of the persons who have these symptoms have only mild symptoms, and some of the people who have mild symptoms do not even care at this time to contact NCDC. So at the end of the day, the total number of cases that we get to test is lower. At this time, we have tested about just above 300,000 samples. We expected that at this time we should have tested over 500,000 samples. So the numbers of new infection that we have is dependent on the number of persons that are tested. And that depends on the number of persons who reports to NCDC. So as it is now, the number of persons that report to NCDC is declining because generally the fear for the virus is declining. People feel that they can live with the virus, they can have the symptoms, and they can recover from it without having to go to the isolation center or be concerned whatsoever. And because of that, we are seeing less number of people, reporting to NCDC about their condition. Yes, when it comes to what state governments are doing, I tell you that enthusiasm has really reduced, and to an extent that has affected, the number of the number of samples that are tested per state. But I would say that Nigerians should not rest on their eyes. Nigerians should not think that we are done with COVID-19.
Okay, Dr. Ekanem, if I may quick interrupt your line of thought. Speaking about if we not haven't peaked or plateaued, does that somewhat generate concern for you, saying that it's been over 4 months that we've been testing, pushing, campaigning, and at this point, a lot of countries know where they are, and we are yet to know if we have picked or not. I wonder what this say of our approach to addressing these issues. Does it also speak to our data gathering as well?
You've just said it. The main issue that we have in low and middle income countries, which might affect our ability to predict whether we have peaked or not, is data collection. Our data approach to data, collection. Right now, if you look at like what I said earlier on, you cannot really say whether we've peaked, because a lot of persons, if you go into the street, you find out there are a lot of persons who are living with the virus, who know that they have symptoms, are not even reporting to health facilities. They are not even contacting the relevant authorities to get themselves tested. If people are not tested, the numbers do not add up. And in the environment like Nigeria, that is the situation. So we cannot say that we've peaked. Because if we have peaked, then we should be expecting that there's supposed to be a sustained decline in the number of infection cases. But you still see that there's a fluctuation. Sometimes it gets down to 200, sometimes it gets, like now it's just above 300. So we cannot exactly say because of what I would call a chaotic data management. But at the end of we still hope that with time we can categorically say that, okay, that the number of cases of COVID-19 in Nigeria is declining. But at this time, we cannot categorically say that.
All right. Dr. Nsiabase Kanem, thank you for talking to us on TVC Breakfast.
You're welcome.